Good afternoon, and thank you everyone for joining the US-ASEAN Internship Program webinar. We prepare exploring career opportunities in the ASEAN healthcare industry. I would like to flag a few housekeeping notes for all the audience as we listen to the webinar this afternoon. You may wish to start dropping your questions in the Q&A box below. We'll get to them with our panelists during the Q&A session later on. Without further ado, let me invite our moderator to kick off the discussion this afternoon. Dr. John MacArthur is the Regional Director for Southeast Asia at the U.S. Center for Disease Control and Prevention, where he leads regional health diplomacy efforts. Dr. MacArthur earned his medical degree from Georgetown University and completed residencies in family and community medicine at the University of California at San Francisco and preventive medicine at Johns Hopkins School of Hygiene and Public Health. He holds a Master of Public Health and International Health from Johns Hopkins. Dr. MacArthur has been with the CDC for more than 16 years and served as the CDC lead for the Amazon Malaria Initiative, including managing the USAID Regional Development Mission, Asia Infectious Disease Funds, focusing on malaria, tuberculosis, dengue, and influenza, and the US President's malaria initiatives in the Sub-Saharan Africa and Southeast Asia. Dr. MacArthur, the floor is yours. Thank you.
Thank you, Marcella. Good afternoon to our virtual participants in the 10 ASEAN member states and beyond. And thank you for joining the US-ASEAN Internship Program webinar, We Prepare, Exploring Career Opportunities in ASEAN Healthcare Industry. I would like to start by thanking the US-ASEAN Business Council and the US-ASEAN Connect for co-organizing this internship series, and a special appreciation to our distinguished panelists and their supporting teams who have made this event possible. The COVID-19 pandemic has underlined the critical nature of health, the role of healthcare workers, and the healthcare industry throughout the ASEAN region. This webinar will provide a unique opportunity to hear from experts from the public and private sectors, as well as civil society. Our distinguished speakers will outline recent developments in the healthcare field, capacity building of tomorrow's workforce, and future career opportunities in healthcare professions. My own organization, the U.S. Centers for Disease Control and Prevention, or CDC, has been closely working with ASEAN member states for decades to strengthen local capacity to detect, prevent, and control diseases. While we are working closely with many of the member states in combating the current COVID-19 pandemic, CDC has also worked with key stakeholders in the ASEAN region to respond to such emerging diseases as SARS, avian and pandemic influenza, MERS-CoV, and Zika. We also have collaborated with national and regional stakeholders on important public health problems such as HIV/AIDS, tuberculosis, malaria, refugee and migrant health, and non-communicable diseases. Not only does CDC work closely with ASEAN member states, but we also partner with US government agencies, UN agencies, universities, civil society to protect the health of the people throughout Southeast Asia region. Our programs focus on generating scientific data to assist leaders in making evidence-based policy decisions. We're also very involved in improving key public health workforce skills in areas such as laboratory, epidemiology, risk communication, and public health emergency management. Clearly, the need for human capital in the healthcare industry is increasing, and there are a variety of stakeholders working together to meet these needs. In this regard, the US-ASEAN Connect and the US-ASEAN Business Council, through the US-ASEAN Internship Program, organized this webinar today to discuss these issues with key public, private, and civil society leaders who will share their insights on the current healthcare situation, emerging opportunities, challenges, and skill sets necessary for preparing the future workforce in this industry to cope with the accelerating demands due to the current pandemic and projected recovery phase. The US-ASEAN Internship Program, launched in May 2018, is a joint initiative between the US-ASEAN Business Council, the US Mission to ASEAN, as a tangible outcome of the United States engagement with ASEAN. The internships posted on a dedicated portal offer Southeast Asian students and early career professionals an opportunity to experience firsthand what it is to work in a US company and to gain insights on how US companies conduct business. This program partners with the Young Southeast Asian Leaders Initiative, ASEAN Foundation, and the ASEAN University Network to expand the outreach and promotion. Before I introduce today's panelists, I would like to cover a few guidelines for participating in this webinar. Audience members are encouraged to submit their questions through the Q&A button below, and the organizing team will select them for the speakers to answer. Please let us know to whom the question is directed. Once the speakers have an opportunity to provide their remarks, we will open the webinar for the Q&A session. I want to encourage the listeners to take advantage of this unique opportunity, as it is rare to have access to such senior leaders throughout the region in health to answer your questions about career opportunities in the ASEAN healthcare space. There is a Zoom chat box below, and please use that for technical questions related to the Zoom portal. Without further ado, I'd like to introduce our three distinguished panelists. Dr. Ferdinand Fernando has been the Assistant Director and Head of the Health Division of the Human Development Directorate under the ASEAN Socio-Cultural Community for the past decade. He is a licensed physician and practiced medicine since 1994. Dr. Ferdinand has extensive development work experience at local and international levels, with more than 25 years collaborating with partners such as the German Development Agency, GIZ, USAID, United Nations Populations Fund, among others. He received his Bachelor's of Science degree in biology and a doctorate in medicine and surgery from the University of Santo Tomas, a master's degree in development and management from the Asian Institute of Management, and continuing health education at East-West Center, University of Heidelberg, and Harvard School of Public Health. Our second speaker is Mr. Julian Mingwal, who has been the CEO of Asia for Health at Cigna International Markets since January 2019. He has profit and loss responsibilities and oversight for a fast-growing Asia region and leads the company's Asia-Pacific Regional Health Solutions, business development, and distribution practices. Julian is a growth-oriented leader with a track record in building successful businesses. He was CEO and country manager of Cigna Thailand for over 4 years, a period which Cigna Thailand enjoyed strong growth and doubled in size. Julian has held several senior leadership roles in Europe and Asia, joining Cigna in 2010. He has degrees in economics and politics from York University and in financial services from the Manchester Institute of Science and Technology. Ms. Milan Sakwarson is a senior international relations officer in the partnerships and international relations section of the Thai Health Promotion Foundation. Currently, she is responsible for population-based promotion and social determinants of health through the global health platforms. Kun Malin is passionate about global health and issues and was one of the young Thai global health scholars, becoming the youngest global health trainer. Additionally, she is Thailand's country lead for the ASEAN Women's Leadership Academy for the Young Southeast Asian Leaders Initiative. Kun Malin has represented Thailand in many global health fora, including the World Health Assembly. Our first speaker today will be Dr. Ferdinand Fernando of ASEAN. Dr. Ferdi, the floor is yours.
Thank you very much, Dr. John. Greetings from Jakarta, Indonesia. My presentation will be on ASEAN health sector, future of work amidst COVID-19 and other implications. Slide 2, please. This will be the outline of my presentation. There were last-minute changes, just to be candid about it. But then first part of this presentation involves an overview of responses by the ASEAN health sector with other relevant sectors in ASEAN towards the prevention, detection, and response to public health emergencies, pandemics, including COVID-19. The second part focuses on the future of work amidst the new normal, or the threats that we are experiencing right now, and other related opportunities. Slide number 3. Next slide, please. As part of the first sub-agenda of my presentation, allow me to share with you our ASEAN Health Development Agenda, which has 4 work programs under the respective ASEAN health clusters, which envisions to achieve a healthy, caring, and sustainable ASEAN community and contribute to the implementation of the strategic measures of the ASEAN Sociocultural Community Blueprint, or Roadmap, for 2016 to 2025. This ASEAN Health Development Agenda has 20 health priorities, which are operationalized through 104 project activities and program activities in their respective work programs under each of the ASEAN health clusters, as shown in this slide. Collectively, these projects and activities at the regional level are designed to complement and enhance ASEAN member states' access to health care. These are being shared in this meeting just to indicate the major areas of regional health interventions that can be entry points of job trends and required skill sets and applied technologies in health. Most of the initiatives right now since 2020 until this year have been focused on responding to all hazards and emerging threats simply because of the impact of COVID-19. However, as highlighted in other health priorities, there are complementary health-related initiatives that would be good entry points for the new job trends this 2021 and onwards. Next slide, please. With regard to the response to COVID-19, the ASEAN health sector has synergized and scaled up its efforts through 27 health-related regional initiatives responding to this pandemic and also preparing for future public health emergencies or other health-related threats. This include, among others, the establishment of the ASEAN Center for Public Health Emergencies and Emerging Diseases and the development of the framework and structure of the ASEAN Public Health Emergency Coordination System as supported by USAID. The ASEAN health sector has also been actively engaged in the development and implementation of non-health sector initiatives as summarized in this slide. Next, one of the 27 health-related initiatives as shown in the presentation slide would be those that are under the Program of Mitigation of Biological Threats, or the program which look into health and security interface. So the ASEAN health sector, through the existing mechanisms and platforms, has enhanced and sustained its response measures that were launched as early as January of 2020 in cooperation with various external partners. ASEAN health sector continues to have technical updates and information exchanges, sharing of good practices, production or drafting of risk assessment reports, and the continuing enhancement of cooperation and coordination in preparedness, prevention, detection, and response among health and non-health stakeholders. This would involve networking among the Emergency Operations Center Network for Public Health Emergencies, the ASEAN Biodiaspora Virtual Center, which would manage programs for big data analytics and visualization, and other agencies that would look into risk communications, as well as networking with other external partners on disease surveillance, as well as laboratory surveillance. Next slide, please. With the adoption of the ASEAN Strategic Framework for Public Health Emergencies in November of 2020, this was considered as a big step towards a coordinated collective action. And following its adoption, the ASEAN Public Health Emergency Coordination System, as supported by the US government through the USAID Prospect in ASEAN, will support the implementation of this framework. Next slide. This is the ASEAN Strategic Framework for Public Health Emergencies that will be the basis or the ambit of future specific standard operating procedures for specific public health emergencies or other hazards. Next slide. As mentioned earlier, and with the support of Global Affairs Canada, the Mitigation of Biological Threats Program and its various project activities have been utilized in the response to COVID-19, as well as in preparation for future public health threats, which would include initiatives on biosafety and biosecurity concerns. Next slide. As part of the 27 health-related initiatives, ASEAN has its existing platform in achieving vaccine security and self-reliance in the region. This was a political commitment that was adopted by the ASEAN summit leaders in 2019, even before the pandemic started. And this slide presents the ASEAN Regional Strategic and Action Plan for the vaccine security and self-reliance in the region. And this is under the leadership of Thailand. It has 5 major strategies with their corresponding outputs. Next slide. And as indicated earlier, one of the initiatives and one of the major deliverables for this year is the operation of the ASEAN Center for Public Health Emergencies and Emerging Diseases. This would be considered as the hub for the implementation of initiatives on three strategic focus pillars, such as the prevention and preparedness, detection and risk assessment and response, and 3 other overarching themes of information sharing and analytics, capacity building, innovation, coordination, and support. These are designed to contribute to meeting the proposed mission as a center of excellence and regional resource hub. Next slide. This would just show that the ASEAN health sector is not doing regional initiatives on responding to all hazards and emerging threats in a vacuum. It has enhanced its engagement with external partners to better respond to the COVID-19 pandemic. With all of this in mind, in terms of what is inherent and what are considered to be the strength of the ASEAN health sector, there are other related matters that should be discussed in terms of consideration of job trends as well as developing skill sets for the future of work. Next slide. Thank you. So this particular slide would just show the next part of my presentation, which would focus on the future of work. Based on the objectives of this webinar, allow me to share with you the ASEAN-related perspectives and experiences that are related to the developments in the healthcare industry and career opportunities in the healthcare profession amidst the challenges we are currently facing. The process of my sharing will be flowing from the internal environment and external environment of the Association of Southeast Asian Nations, as well as the ASEAN health sector perspective, which would contextualize its strengths and comparative advantage as an intergovernmental organization, the organizational and systematic areas that are currently being improved within the ASEAN health sector, the challenges it has to address, and the opportunities it has to maximize for a regional organization with a global influence. As you may have known, previous slide, please, previous slide, sorry. As you may have known, COVID-19 has not only been a health crisis that has affected the fragile health systems of some of the countries in the region and has caused pain and suffering for those affected by this pandemic, but COVID-19 has also brought significant disruption to the global economy, including changes to the jobs landscape or the future of work in the region. As shown in this economic forecast as of July 2021 from ADB, recovery is underway in the developing Asia, but the growth projection is revised down slightly from 7.3% in April to 7.2% for the rest of the year. This is due to the renewed virus outbreaks in some economies and the recent surges and lockdowns being experienced by some of the countries in this region. The 2022 forecast is upgraded from 5.3% to 5.4%, however. But prospects are still varied among different regions in Southeast Asia. Growth forecast is downgraded from 4.4% to 4.0% in 2021, as some countries, as mentioned earlier, reimpose pandemic restrictions. This will be followed by 5.2% growth in 2022. And these are due to the recent outbreaks of COVID-19, driven in part by new variants, and has dragged the recovery of several economies in the region. Vaccine rollouts are progressing in many economies, but most of the ASEAN countries are still far from achieving herd immunity. So based on this scenario and referencing the article of Ms. Karen Gilchrist and the jobs on the rise, the fastest, next slide please, the fastest growing job is that almost the fastest growing job trends in the region since the start of the year include careers in healthcare, education, and digital services. As shown in this slide, it has been summarized through these articles or these source materials that the common trend amongst this growing job is that almost all may be conducted remotely. As a result, workers who are equipped with digital skills, even at the minimum level, will have an edge in finding employment opportunities within these fields. As shown in the slide, these are some of the highest job trends, now you might say, in the list of peoples in ASEAN looking for specific skill sets to apply for. Uh, an example of which is, of course, healthcare and medical support. And we have seen the demand of medical support personnel during this pandemic. And other than the traditional healthcare roles like medical doctors, clinical nurses, or other ancillary specializations in the hospital or healthcare fields, we have seen the demand for other medical roles coming from the population of pharmacists or pharmacologists and medical technologies, simply because of the demands of this pandemic with regard to healthcare interventions and health services. Also, as one of the job trends in this list would be the healthcare and medical frontline workers. So as the region responds to the threat of COVID-19, we have seen frontline healthcare roles grow in demand, and at the same time, one of the most vulnerable population affected by this pandemic. This job will still be relevant as we live and move through the new normal based on the impact of this pandemic. And also, data analysts and software technology, well, based on the rapid adoption of technology as we move towards the fourth industrial revolution, this has allowed organizations, agencies, companies to collect large amounts of data and use it for innovative solutions and risk assessments. So these are just a few of the job trends for 2021. And we go down further the list, which would include cybersecurity, e-commerce, digital content specialist, public relations, customer service, education, finance and insurance, etc. All of this aforementioned job trends that started in 2020 and onwards require the necessary skill sets and applied knowledge to be competitive, adapted to the signs of the new normal, and enhance appropriate competencies based on the demand. Next, please. Aside from the threats and impact of public health emergencies, COVID-19 and its non-health implications to the prospect of careers or job trends in the region, there is a need to share some key points relevant to the future of work across ASEAN in the midst of other opportunities, such as the fourth industrial revolution. In ASEAN, there is the ongoing internal consultation with regard to the consolidated strategy on the fourth industrial revolution, or 4IR, for ASEAN. This document presents ASEAN's strategy in approaching 4IR as a community to maximize opportunities, maintain openness, transparency, and security, foster economic growth and connectivity, and promote inclusive and equitable economic development. I cannot share much on this since this is under a different pillar and sector, and this is currently being consulted internally. According to this document, though, the 4IR is reshaping economies and societies around the globe through unprecedented, rapid, transformative, and irreversible changes to the way we produce, the way we work, the way we live, and the way we interact. It presents new opportunities and challenges for governments, businesses, and societies at large. Next slide, please. As ways forward, this consolidated strategy will be implemented that would include initiatives, among others, e-governance for bridging digital divides, technical and data governance, cybersecurity, digital trade, enhancing service sector with applied for IR technologies, and digitalization of social welfare and protection. With this final slide, I end my presentation, and thank you very much for your kind listening. Over to you, Dr. John MacArthur. Thank you.
Thank you, Dr. Ferdy, for those very interesting and comprehensive comments. I just want to remind our listeners that the Q&A button is below, and please go ahead and start placing your questions there. Our next esteemed speaker this afternoon is Mr. Julian Mingwal of Cigna International. Julian, I'm going to turn it over to you.
Thank you very much, and hello everyone, and good afternoon. Salamat sore. I'm delighted to be here, and it's a huge pleasure to be able to speak to you on behalf of Cigna International Markets and share some insights into working for a major American healthcare service company such as Cigna. Next slide, please. Today I'll share some insights with you on who we are, what we do, and who we serve, before discussing some of the impacts of COVID-19, how it's redefined our lives and reshaped the way we do business, and what that means for the future. Personally, I've been for Cigna for over 10 years, and a lot has changed in that time, but the past 18 months in particular has really been a period of accelerated change, which is having widespread impact on how businesses work, and has also shaped many people's careers and careers for the future. I'll share some of my thoughts on those evolving career paths and also the new expectations, and we'll try to share some perspectives and experiences working for a major healthcare company. Next slide, please. First, though, a quick introduction on us and who we are and who we serve. Through our international business, Cigna has an extensive global footprint that spans 30 countries and jurisdictions, serving more than 15 million customers around the world through three key buying groups. The first are corporations that we serve. These organizations primarily are there to support their employees on international assignments. They're senior executives who require extensive regional or global health coverage. And globally, we are the largest health services provider for expatriates and a leader in the Fortune 500 companies. So this is one group. The second group is a market leader in serving governments, non-government organizations, and intergovernment organizations. We support their employees both locally and abroad. And finally, the third group we serve are individuals providing a range of supplemental health, life, individual private medical insurance plans. For all of these groups, health and well-being has become their biggest priority over the last 18 months. And I can imagine it's the same for everyone who's on this webinar today. Concerns over access to affordable, quality healthcare are top of mind for our customers and clients outside the US, as much as they are for people inside the US. And it's a key part of our success has been our ability to leverage global best practices and apply them in the most appropriate way to make them locally relevant to the customers and clients we serve around the world. We think global, but we act local. Next slide, please. As a global health service provider, we keep abreast of the trends and the market forces impacting the industry. And this, coupled with our data and analytics strategy, helps understand more about our customers and their evolving needs, and is reflected in our network and clinical offerings. Although people often think about health insurance being something you use when you're actually sick, as a business, Cigna strives to provide healthcare, not just to look after people when they're sick, but also to keep our customers healthy by preempting the issues they might face. Four key areas that are impacting our business in international markets. An example of the local solutions we have created to address these are as follows. Firstly, the growth of the middle class. This continues to accelerate in emerging and developing markets. It creates new needs with respect to health and wellness. The middle class is growing fastest in developing markets, and Asia is expected to represent 2/3 of the global middle class by 2030. In Thailand, our enhanced health suite of products have been developed to meet the needs of that working middle class group. Our office syndrome disease protection product covers office-related ailments such as carpal tunnel syndrome, occupational eye disease, metabolic syndrome, to name a few benefits. So this is one group. The second group I call out is aging population as a global phenomenon. The reality is 1.5 billion people in the world are going to be over 60 years old by 2030, all with greater and more complex health, medical, and care needs. In Korea, as an example, we've developed a range of what we call silver products, which are aimed at the over 65s. They include our silver medical product, our silver cancer product, and our silver dementia product. A third area of focus for us is seeing an increase in chronic diseases globally, which are unfortunately a result of our lifestyle changes and the simple fact that we're all living longer. For example, more than 60% of people suffering from diabetes live in Asia as well. So in India, we've developed a pro-health plans which provide comprehensive medical coverage with 5 different benefit options to allow customers to select their own plans which match to their affordability and their needs, while offering wellness and rewards programs to keep them healthy and allow them to take control of their own health. And finally, the fourth group revolves around governments, individuals and employers alike, who all face the same challenge, which is getting consistent access to affordable, quality healthcare. Again, in Asia alone, there's a $1.8 trillion healthcare gap. So we're working with governments to help meet their population needs by providing products which are affordable. In Hong Kong, for example, we have 3 certified plans under the government endorsed voluntary health insurance scheme. And it's a great example of a public-private partnership where we're helping the Hong Kong government reduce the burden on the public health system by diverting patients to the private health system. Next slide, please. So whilst we're addressing these key trends, the reality is that COVID-19 has done more than anything in the world recently to reshape societies, economies, and our lives. Its impact will be felt again for years to come. As a global healthcare company, we've been monitoring its impact closely from the beginning back in earlier 2020. The pandemic has been a catalyst for change, creativity, and adaptation. Firstly, it's forced the world's largest work from home experiment. In the US alone, 67% of people have worked remotely since this pandemic started. People have also increasingly turned to technology to stay in touch with friends and family and adopted virtual healthcare, with levels of increase of over 600% year on year. And finally, we've seen hundreds and thousands of new employees coming on board to companies in the last year or so who've been interviewed remotely, have started their role remotely, and that's creating a whole new series of opportunities and challenges. Many of you on the webinar today may have had the same experience and may have failed to meet many of your colleagues face to face. The COVID-19 pandemic has also impacted the lives of most, if not all, individuals. It's increasingly apparent that mental health has been particularly impacted as people deal with personal, professional, and societal circumstances which are in constant flux, creating high levels of stress. Our own research indicates that 86% of people say they are always stressed, and 78% feel the need to be always on when they're at work. What's certain is that employees need more support as they tackle the challenges of the pandemic and beyond, and there's a growing expectation that employers will provide support that goes beyond the basic health insurance package and tackles things like counselling and even financial advice. Most worrying is the most recent report released only last week that showed that referrals of adolescents and younger children to mental health support has increased 300% year on year. This is clearly a big area of focus. Global travel has also been at a standstill. And although we're beginning to see some signs in some parts of the region of travel returning, global air passenger traffic fell by nearly 2/3 last year compared to 2019. This has affected many of our customers and also those globally mobile individuals who struggle to see their family due to closure of borders and travel restrictions. And finally, governments around the world are facing the prospect of dealing with record levels of debt, having used their financial reserves to support people with huge stimulus packages. This raises a number of challenging questions about the future. Next slide, please. As a business, we've understood we have an important role to play in supporting our customers and employees during this pandemic. Cigna took a number of important actions to help protect against the spread of the pandemic and the virus and to help ease the financial burden. To give some examples, we waived cost sharing for diagnosis tests and treatments for COVID-19. We made it easier for all of our customers to access virtual healthcare through our telehealth platforms globally. We expanded that to all our medical benefit customers who are overseas. We leveraged our clinical teams to monitor outbreaks and symptoms. We provided financial relief. We provided ongoing health advice in line with the WHO guidance. We protected customers from billing surprises. We even provided vaccine coverage in our plans. In addition to the communication and collateral, we also created resources to help people know what was happening with What You Need to Know programs, which was our updates, articles, and other documents. We had our impact studies, which assessed how COVID-19 is impacting people. And we also covered vaccine perception studies and advice in those areas. We did a whole of health webinar series, and we also tailored COVID-19 information to both our clients, our intermediaries, and our end consumers, as well as providing ongoing support to employees, as well as health guidance in accessing the workplace. Next slide, please. So what's it all mean for our industry, and how will it look in the future? The pandemic has resulted in a number of permanent changes to our lives, many of which will revolve around a more flexible and connected workplace. Firstly, as I've already mentioned, our workplace is going to be increasingly mobile. 61% of the workforce want to work flexibly. Many people have enjoyed the benefits of reduced commuting time, more time with family, and the ability to fit their work around their needs for their children and other responsibilities. For many companies, including Cigna, this means that offices won't be used in the traditional pre-pandemic way. We've begun to transition some of our offices into more collaborative spaces for the days when teams need to come together rather than focusing on individual desk space for solo tasks. We've also been rethinking our HR leadership approaches to support this new hybrid working world, to ensure that all our employees, especially our new hires, feel integrated and connected with the wider organisation. And in order to support this, there'll be continued investments in workspace technology as we connect more online. 43% of IT leaders expect to see increases in technology and spend to build infrastructure to support the hybrid workforce. And when I look at our customers, healthcare is becoming increasingly virtual. Demand has increased by over 600% in the last year, and 59% said they would be more likely to use these services in the future. Although much of the increase in virtual health was driven by necessity during this pandemic, I believe that virtual health is now a mainstay of the patient journey going forward. In fact, in the last year, we've identified certain areas where virtual health can add benefit for patients. For example, we've looked at mental health. According to our recent wellbeing surveys, people are more willing to use virtual health because it provides a safe, private space where people feel available 24/7 to be able to talk to someone and access the care they need when they need it most. And finally, we're seeing more people take a more engaged approach to their healthcare cover, ensuring they have access to the best care should they need it. They want access to information, resources to help them manage and improve their health and well-being on an ongoing basis. With the pandemic highlighting the importance of mental health, we believe that mental health support will become increasingly important and recognised as a priority for corporate leaders. Next slide, please. At Cigna, we've also recently announced our new strategy to be champions for simple, affordable, and predictable healthcare. This comprises simple, making it easy for people to get access to the care they need. As I touched on earlier, that means access to virtual care, as well as digital tools, digital claims services, and customer service access. Making it affordable, building differentiated positions to lower the total cost of care. This includes the use of data analytics to drive insights that enhance affordability, access, quality, and experience for our customers, as well as looking at care innovation by redefining how care is accessed and making sure that technology enables sites of care and new care models evolve. And finally, making it predictable. We want to take the surprise out of the system and help people make informed healthcare choices. This is created by creating strong engagement between our customers and our welfare experts and wellness expertise, creating robust preventable care and case management models, which enable us to forecast and manage care requirements accurately going forward. Next slide, please. So what does this all mean for you and your fledgling career in healthcare? What are the expectations and skill sets that employers will look for? Well, on a practical level, the workplace of the future will look very different than it has in the past. And therefore, all businesses are looking for employees who are going to be able to embrace the flexible hybrid workplace and thrive. Being self-motivated, resilient, and driven will be key components for getting things done in this type of environment. As I mentioned previously, the importance of health and well-being is now being recognised in a way that it wasn't previously. Health is booming. There's a lot of buzz, a lot of excitement around our industry with new solutions and innovation innovations every single day. If you have a real passion to be involved in healthcare, then keeping on top of the latest trends and innovations will be important. At the core of everything we do are our patients and our customers. Working within healthcare is tremendously rewarding. It's a real opportunity to positively impact people's lives. It's not every day that you can meet customers where you actually made that difference at that critical moment. And we have a role in making the world a healthier place at a time when it's needed more than it's ever been needed before. Doing something meaningful starts with a simple decision, a commitment to changing lives. And at Cigna, we've made our commitment to help everyone live healthier, happier, and more fulfilling lives. And at Cigna, we're people. We're a human organization where people come first. Whether it's our customers, patients, clients, or colleagues, we aim to improve the health, well-being, and peace of mind of everyone we can reach. Next slide. So many thanks for listening. I'd be delighted to take questions later as part of the panel, and please feel free to send them through. Thank you.
Thank you, Julian. Very, very interesting talk, really showing the need to be flexible during these extremely challenging times. I'm looking forward to the Q&A session to hear a little bit more in-depth discussion about how Cigna managed change, which sometimes can be a little bit of a challenge. Just again, to let our participants know, please don't be shy. Send your questions in the Q&A button, and our participants will address those later. So our final speaker today is Ms. Milan Sakosen from the Thai Health Promotion Foundation. Kun Milan, over to you, please.
Thank you very much, John. Let me share my screen. Okay. So the pandemic is a wake-up call for global attention to healthcare. At the end of 2020, $14 trillion was spent on the global COVID relief. In Thailand, actually, the budget for COVID vaccine research alone reached $100 million, almost 100 times more than the usual situation. So, however, the absence of disease is not the primary goal of healthcare. The healthcare industry, as we talking about today, is a well-being, not disease and infirmity. So this requires a larger perspective from the health professional. So my friends, who is the Dean of School of Public Health Department of the National University of Singapore, told me that it is crucial for the graduates to see their fit beyond just healthcare and go into their health promotion and disease prevention and other area of public population health. So today I would like to give you, as most of the audience are the young generation and will be the new graduates, as I recall. And so I would like to give the futuristic view through the mega trend that will affect health in 4 elements, as you can see the 4 pictures down here. First, there will be the challenge brought by the climate and environmental changes, such as water, food security, and also the pollution, like we have in common here in ASEAN, PM 2.5. Air pollution prematurely kills approximately 7 million people a year. It is especially dangerous for children. Sorry. So this can refer to One Health approach promoted by WHO and Planetary Health, supported by Rocky Foundation and launched by Lancet, which these two addressing all creatures share the same ecosystem and share the same consequences. So those who are in the environmental field or ecological field can take this health effect as another key for environmental protection. So actually I have been working in the global health platform for 5 years, and lately I would say I saw many new faces from the environmental and ecological fields join us and make some contribution. Sorry. Second, the population change. I'm sorry, but my slides keep bouncing. By 2050, 80% of older people will live in low and middle income country. And the share of the world population residing in urban area is projected to increase nearly 70%, much of this in Africa and Asia. So rapid, unplanned, and unsustainable urban development patterns will make many emerging environment and health hazards. So this also included displaced population with rising burden of tropical diseases. So this trend requires the skill of social work and architecture, especially urban designs, and so many. Third, the geopolitical changes. There will be geopolitical tension linked to the displaced and refugee population. However, the positive trend would be the interconnectedness to other countries. ASEAN is a great hub for wellness services based on our geography and low cost of living. Thailand before COVID, every year we receive around 30 to 40 million tourists around the world, and about 3 to 4 million were OPD patients, which 1/3 were foreigners who live in Thailand, another 1/3 were short-term visitors, and the last portion were those who intentionally travel for medical treatments. And major travelers were from ASEAN. So ASEAN has an interconnectedness in healthcare services, which include hospitality, medical services. Therefore, people with social science, linguistic, or communication backgrounds will help build the linkage and communication and foresee the trend of changes. Last one, the health and technology. As previous speaker mentions a lot, health promotion and prevention with particular focus on non-communicable diseases is seen as the most viable opportunity for large-scale technology implementation in low-middle income countries. The Dean of Silirat Hospital, the oldest hospital in Thailand, mentioned the collaborations with the engineers during the COVID-19 to help them build up new technology innovation for both COVID and non-COVID patients, and the technology to connect patients to the hospital without traveling. So healthcare will be decentralized to remote devices in 4P, as you can see the diagram here, to be personalized, predictive, preventive, and participatory. Telemedicine and pharmacy will be the new normal for healthcare services. As Julian mentioned, their virtual health increased up 600% during the COVID time. And this new normal will remain even though we overcome this pandemic. So in our conclusion, what it will look like in the near future, from my knowledge, I think public health will be more individual-based and self-resilience, such lifestyle medicines and genetic screening. Non-communicable disease still be and will be the major cause of death. Therefore, we need other non-health skills, which is essential to build up the better environment and lead to behavioral changes, which are the crucial prevention for well-being. Thank you very much. ขอบคุณค่ะ
Thank you, Kunalin. Again, a very interesting talk. So thank you all for your insightful comments. Clear to me that the three of you have a wealth of experience in the ASEAN region and really put some things out there for us to digest and to think about and coming at this in a sort of holistic way. As I promised earlier in this event, we're going to open the time up now for about 15 minutes for Q&A session. So please use the Q&A button and let us know what your questions are. If it's directed to one panelist in particular, then just put that into your question and we can do it. So let me transfer using technology here and grab my phone, which the moderators are going to be feeding me some questions. So while some of the questions come in, I think what I'll do is just take the moderator's prerogative to raise a question to all of you, just to start with, kind of prime the pump, if you will. And that's that the pandemic has increased the importance of building a more resilient public health ecosystem in many parts of the world, especially Southeast Asia. How do you think higher education institutions should respond to these needs? What is the X factor that medicine, biotechnology, and public health schools need to consider to prepare their students in entering the industry in a post-pandemic era? So what is that X factor? What can universities do to prepare tomorrow's workforce? Maybe because I know that Dr. Purdy, you may have to exit the stage a little early because of some issues going on in ASEAN. Perhaps I'll let you take the first stab at this response and then open it up to the others.
Thank you so much. From the perspective of the current ASEAN health sector initiatives, as well as the other non-health ASEAN related programs and projects and researches, allow me to refer to you the recent study that was published, which we call the ASEAN Rapid Assessment the ASEAN Rapid Assessments. A question came in which I already responded to. Sorry, John. Yeah, we have the Rapid Assessment in ASEAN with regard to the impact of COVID-19 in the livelihoods of the peoples of ASEAN. This is a joint activity between the social welfare, labor, and education. Now, with regard to you might say an equal access to alternative educational platforms during the pandemic, and this has posed certainly so much challenge for some of the ASEAN countries. And given that the pandemic is not yet over, definitely many of these challenges related to education and affecting the educational sector particularly will likely to continue. So based on my presentation earlier, wherein basically I presented strengths, weaknesses, opportunities, and threats to the ASEAN architecture as well as the health care industry, there are opportunities for ASEAN member states to build on an improved education system. And this would include investments in remote learning or investments in capacity building and frameworks that would be adaptable to the current conditions of the community or the province or the area with which COVID-19 is very much on the upsurge. Second, there could be improved learning support for students, including out-of-school children from vulnerable groups and marginalized communities, meaning interventions should be also specific to the target population who are really at need. This would include, as I mentioned, vulnerable population and key populations. And also, you might say, enhancing the alignment of the curriculum with regard to the future of work, meaning the educational system, the structure of education, the methodology, mechanisms, the platforms, as well as the skill sets that will be utilized and taught will have to respond to the demands of the fourth industrial revolution, particularly with regard to the future of work, including aspects, as I mentioned earlier, digital economy, digital technology. So we have to, might say, adjust to the signs of the times and adjust to the new normal, and be innovative in our education by not sticking to what is traditional, but rather evolving and adapting to the demands of education that have been affected by this current setup of lockdowns, movement restrictions, as well as inability to gather in groups in terms of in-person trainings or in-person education. Over. Thank you so much.
Thank you, Ferdy. Julian or Kunmalene, can you add on to that, or
yeah,
I think Ferdy's
sure.
done a good job?
I'll be brief. I mean, I think firstly, education is the great equalizer. I'm grateful for the education I've had. I don't think I'd be in the role I'm in today without it. So I'm very passionate about it. I think first and foremost, education needs to be about skills, not knowledge, because your skills is what the future's around, not knowledge. It's about how you adapt and change. I think technology and platforms of access will enable lots of people to be able to access education, which therefore will create better prosperity and better ability to develop skill sets. And I think on top of that, it's updating the education system for the needs of the future. So skill sets is one. The second is the way education is delivered through technology and platforms as well is going to be really critical. And I think organizations like ours have an opportunity to play as well through internship programs. So for us, for example, we work with places like Gajah Mada in Yogyakarta for the actuarial talent, and how we then engage and share learning. We run internships across Asia where we bring people in to experience different types of skill sets, be it actuarial, be it finance, be it marketing, but all focused around healthcare. So I think there's a private-public partnership opportunity. And I think the education itself, it's about redesigning how things are taught, making it more accessible through technology platforms, and also being much more skill-based focused.
Malene, in your comments, you talked about sort of marginalized populations. I think you even had one slide that specifically talked about refugees. And I just wonder if you can comment, there's a lot of discussion we're having around technology and the role of technology in health, whether it's through telehealth and contacting your provider, or through education processes. But unfortunately, sometimes those refugees in your slide don't have access to that. And might technology actually create new barriers to healthcare that we've got to think? I wonder if you could comment on that.
I would say, like, I'm not sort of the expert for the vulnerable population or refugee, but I would say, like, it's not about the technology or anything. I think they need to get their own right, like universal health coverage that should be covered this kind of leftover population, as the Fernando mentioned that in ASEAN we try to promote USC, right? And I think this kind of group need to be covered. No one left behind, as the SDG always mentioned. So I think if the system go to them, the technology will follow. Yes, thank you.
No, that's great. I'm sorry to put you on the spot, but I do think it's an important question that we have to look at is access to care, because we spent multiple decades, I think since Alma Ata's meeting on primary health care to increase health for all. And as healthcare changes its nature, we've got to think about that. So that's one thing I think the students can look at. Certainly a lot of emphasis in today's speakers on technology, the role of data, how we collect data, interpret those data, and utilize it, how we use new communication systems, either working at home or through education or accessing care. But I think it's important also for those of you who have an interest in marginalized populations around the ASEAN region or beyond, that you think creatively. And I think, Julian, you brought that up in your talk about how you have to keep thinking innovatively and creatively and looking at what the issues are and coming up with new answers for that. I wonder, Julian, if I can address this next question to you, because you're representing the business sector, and sometimes our students are traditionally thinking maybe a different line when they're thinking about healthcare. And I wonder if you can highlight, not just in the insurance, but try to put on an overall business sector hat or private sector hat, and talk to the students a little bit about how the variety of different private sector partners that are out there can be an avenue for careers in health.
Yeah, thank you very much, John. And yeah, for me, healthcare is quite a broad topic. Traditionally, it's thought about as the primary care physicians and the people in the front line, and clearly they play such an amazing role and have been so prevalent during the pandemic. But actually, there's a load of ways that healthcare is affected. So I think of healthcare and the roles we play in insurance or the private sector is quite interesting. So, for example, if I think about different skill sets and groups, we now have sort of data analytics, we have our own clinicians, we have people who actually put together our propositions, and all of the focus is around how do we make healthcare affordable? Because again, we talk about two concepts here that you touched on earlier, John. One is access. Without access, health is the most important thing we've got. It's a basic right and a very important thing we should have. If I can't access healthcare, then that's the first problem. And if I can, then it needs to be affordable, because otherwise I can't get the quality of healthcare I need anyway. So in our profession, there's a few different ways. We have the data and analytics teams and the clinicians, where we are predicting and understanding up front and gathering insights on the likelihood of someone becoming ill and how we can intervene earlier to shape and help people and prevent people getting the conditions in the first place through education, through engagement. I think that's a particularly powerful statement. And in the private sector, one of the things I'm excited about, and I hope it comes across, is when I get up every morning, I get home from work in the evening and say, what did we do differently today? What difference did we make to a number of people? And in our industry, actually, we sit side by side with our customers, because actually we want the same thing. We want our customers to be healthy. We want our customers to have long lives. We want to be engaged, because we see all the side impacts just as individuals, but also from our customers when they're not, when they've got family members and all the pain that goes with that. So healthcare is deep and personal in the private sector and the public sector. So it's inspirational, and there are many different ways we can make a difference, from our clinicians who deal with customers and help guide them through the care pathways and help them get better with care plans, through to we have people in the data and analytics world who are helping us predict and model and intervene. How can we make a difference to people proactively, through to the folks in the people side, and really making this attractive, bringing people on internships that they can experience firsthand what I'm experiencing, and then wanting to join and make a difference. And also then partnering with digital up and coming healthcare players, partnering with providers to create innovation. So one example, and then I'll hand to someone else. During the pandemic, and to touch on your point about access to care, we realized there'd be many people who wouldn't get the regular access they needed because they wouldn't go to a hospital. And we realized some care still needs to be physical. It can't all be done through a virtual access. So we actually had chemotherapy treatment taking place in someone's home in Hong Kong. So they had the necessary treatment to help them continue their care, and therefore all the treatments they needed. To me, that's why healthcare is deep and personal. That's why I'm passionate about it. And that's why I think in the private sector there's so many opportunities to touch and make a difference every day. Partnering with some of the other critical, more traditional ways of thinking about healthcare, e.g. the people who day to day are taking the pulse and making the difference.
Thanks so much. That's a very heartwarming story, the chemotherapy story. Hopefully, Dr. Ferdy is still on, because I wanted to direct this to him. Dr. Ferdy, with regard to future career growth, are there any additional certificates, training, or initiatives that could support ASEAN healthcare and its programs, something that would stand out as a gap in needs?
Hello again. With regard to training or continuous medical education or other education that is related to healthcare, there are regional initiatives that are being proposed and being consulted as of this time with regard to having an online training on basic emergency operations center for public health emergencies, basic information and basic skills in handling public health emergencies through the emergency operations centers of each of the countries. Second, there are also initiatives with regard to building the capacities of officials or peoples of ASEAN working on disaster medicine or disaster health management, and this would pertain to enhancing capacities on emergency medical teams that could be deployed nationally or regionally. And there are also upcoming skills training on big data and analytics that would be utilized in risk assessments for public health emergencies or other health threats. So this particular samples of training and capacity building activities that I have mentioned are part of the regional program strategy of building the capabilities and capacities, not only of the person, but also of the organization that are involved with the responding to all hazards and emerging threats. These are offered to officials who are already involved in this particular health priorities. Now, this is just with regard to matters pertaining to prevention and control of diseases. However, in terms of might say certifications or agreements related to mutual recognition arrangements, this is or certifications related to that. These are still subject to national prerogatives and national policies, and what can be done at the regional level, not only within the national, not only within the health sector, but also in the non-health sector, would be the establishments of certain guidelines or standards that would address the common gaps of ASEAN member states with regard to further training or further education related to the healthcare industry or healthcare or other specialities that are related to the provision of health and well-being to the peoples of ASEAN. Over. Thank you.
Bertie, if I could just follow on that, there was a question specifically talking about the recognition of the ASEAN Mutual Recognition Agreement for doctors and healthcare workers. And the participant is asking why it's increasingly difficult for medical graduates to practice in other ASEAN countries. And how can we remove those barriers to ensure more increased mobility around ASEAN?
Okay, that's a common question being asked to our health division, but also I would also like to inform the participants in this webinar that it's a mutual recognition arrangements that has been under the purview of the economic community pillar, particularly those dealing with the healthcare industry or healthcare services. These are seen as barriers to trade or barriers to economic progress of ASEAN. It has been made difficult simply because in a practical sense, from my perspective, although there would be a certain equivalence that has been agreed in terms of education and standards and skill sets for healthcare, there are still the need for this respective health professionals to comply with the national requirements of the country that they are willing to work on, they plan to work in, and also plan to participate in the healthcare industry. So it's very dependent as well on what is required in terms of the national policies of the country concerned. Over to you. Thank you.
Yeah, not to mention the language. I'm thinking of as a young medical student, I went to Thailand, and I think I can still say "jip kaw mai," because they taught me a few words with the patients, but I didn't have much luck without an interpreter there. I wanted to. We're going to extend just for a few more minutes. I wanted to ask all three of you a question because sometimes with the student as they're coming out from their studies, taking that first step into a career in healthcare is somewhat challenging, especially if they're taking a non-traditional route. The traditional route might be a nursing degree, a medical degree, a medical technology certificate, something along those lines. And I'm just wondering, first with you, Kunalin, for somebody who's interested in civil society, what would be the first step? I mean, does your foundation offer an opportunity to do fellowships or internships? And I'm going to ask this fellowship internship to Cigna and to ASEAN as well. I'm just wondering, if I was a young student and I really was excited about what I heard from you today, and I said, civil society is really where I can have an impact, but I'm not sure how I can start. How might I take that first step after I finished my education?
Thank you, John. Actually, I have declared that my organization is not the civil society. It actually under the government that has been funded, isolated from the government budget. So basically, but my organization also worked with various civil society, and I saw many young generation contributes so many achievements. I think it's about this day, as I mentioned in my presentation, is about what happened in the future will be more personal, will be more individual. First, you need to find yourself, find what actually is your strong point. For me, I haven't been mentioned. My background is international political economy, and up here, I would say blankly, I start with no clue that I would come on this path, but I would leave you the three things that I would love young generation to remind themselves. First, you need to be more. You need a growth mindset, because this pandemic happened, and we never thought that we could come today. The growth mindset will give you the self-resilience, and also you need to build up your network, your own network, and that will create a lot of social intellectuals for you. And lastly, I would say you need to be mindful about the emotional intelligence. So I think this is the good start for young generation and new graduation to explore. Thank you.
Great, thanks so much. Julian, I'm going to send you an email. I'm looking for an internship. Does Cigna offer something like that? And if so, can you talk to us? Or if not, can you explain other ways that somebody who's interested in working for the private sector, particularly insurance companies, how do you get your first step after you finish your education?
So there's a couple of ways. For those who haven't gone down the specialist route, I'd kind of maybe double down on some of the comments just made, and then kind of broaden out to the routes we take. So I'd say firstly, the characteristics that we'd be looking for in someone is a passion for what they do, being very emotionally attached to the vision that we have and what the difference we want to make, and being obsessed by that virtually, being curious, so having curiosity, asking questions each day, pushing yourself forward to learn new things, having strong levels of desire, creativity. We talked about resilience already, but being proactive to be relevant. I think about myself, I don't have a health background. I've learned my health stuff in the last 2 to 3 years. So again, that comes from a curiosity, a desire to make a difference. So I think first part is characteristics. Second part, if you want to take then the step forward, so healthcare matters, you want to make a difference, you want to impact people's lives, then you start thinking about different ways you can do it. So specialist route, yes, I want to be a frontline person, and so I want to be dealing with patients on a daily basis. And then you might take the pathway into the private sector from there, because you can do it in a very different way. So we have clinical teams, etc. So later in career, maybe you don't want the day-to-day in the same way, you want to make a difference in a new way, and also take companies like ours on that journey. That's one version. But the second is what we do with people, as you said, first job coming out of different practices. So firstly, you don't have to have a medical degree. Yes, that's great, and we would look at those skill sets and we'll always need them, but actually there's a second set of skill sets. So we're looking for people with the data analytics knowledge. We're looking for people with financial actuarial skill sets. We're looking for people who have a marketing skill set, innovative and transformational skill sets. How can we transform what we do? Because if you think of the skills we need, being great and understanding medical is important, but with this comes many things. So I think of, for example, programs we've built. So I think of programs where, for example, recently in Australia, we've reduced the cost of care for customers by reducing readmission rates for medical practice, and we reduced costs by over $200 per member. That's significant to make healthcare more affordable. But that's been built using clinical teams to build clinical programs. That's been then marketing those programs, building customer connections so customers can understand how to use the services. Then how do we engage with them through digital platforms and face-to-face to take them on that journey? How do we make sure we build care afterwards? That's a whole set of disciplines. It's not one, but they're all packaging up a solution that's making a difference for people in accessing care. So for us, we have internships in many different areas, from finance through to marketing, through to some of the health specialisms, that we would welcome the opportunity for people to come and experience that with us firsthand. And then they can decide if this is the space they want to be in. And if it is, there's plenty of opportunities in what is the fastest growing industry in my mind globally, and will continue to be.
Thanks, Julian. I for one can speak that I can feel your passion, having with only 2 to 3 years experience in the healthcare industry. It's still, I feel that passion. Ferdy, I'll give you the last words on this topic, and I think we'll transition away from the Q&A session after this.
Basically, from my perspective, we just have to respond to the signs of the times, particularly not only what we are currently experiencing, but also building on what is expected, preparing on what is expected. As I've said earlier, there are a lot of opportunities in the future that is ahead of us, like the opportunities and initiatives offered by the Fourth Industrial Revolution, the focus of ASEAN with regard to human capital development, as well as the future of work with regard to the lessons learned from this current pandemic. And as mentioned earlier, what is important, and I would like to reiterate what was shared by my colleagues, it's not only knowledge that is important, but also learning new skill sets and adapting these new skill sets with the appropriate applied technology to respond to the needs of the times as well as future needs. And as I've mentioned earlier, one of this would be responding to the applications of digital technology in traditional settings and traditional work areas so that we can proceed much further in terms of innovative care and innovative interventions. Over to you. Thank you, John. Thank you, colleagues.
Thank you so much. I do think it's important for young students. I mentioned my going to Thailand as a medical student and learning a few words in Thai. I mean, that was just one of many small experiences that begin to layer upon each other, that then begins to build a resume that then begins to attract. And so any opportunity that two students can have to just have, even if it's a 2-week internship, a month internship, a winter break internship, whatever it might be, take that, because ultimately those begin to layer and you can pull those together and impress a guy like Julian. When you sit down for your interview, you show your passion, you ask lots of questions based on your experience. All right, thank you so much for the fantastic questions from the participants. Thanks for great answers from our speakers. I'm going to turn it over to Marcella now, who's going to give us a little overview on the US-ASEAN Internship Program, speaking of internships.
Sure. Thank you so much, Dr. John MacArthur, and to our panelists for the great discussions. Before we wrap up, I just would like to remind all participants to check out our US-ASEAN Internship Program website. You can visit the link that is provided on your screen, and it will be also shared via the chat box. The website contains a number of internship opportunities in the top US global MNCs in various different sectors, and they are also located in cities across Southeast Asia. You'll be prompted to sign up or sign into the website. Once you have an account, you can enjoy some of the features such as an access to our webinar materials, events updates, and you can also drop your resume for our company recruiters reference. So as you navigate some of these opportunities, you may click on the companies that you are interested to work with, or click on any of the job categories that match your background. You can click on the apply button on the job that you'll be, and you'll be directed to the career pages of these respective companies where you may submit your applications. So I would also like to remind everyone to fill out our post-webinar survey. The link will be provided in the chat box. And if you require a certificate for attending this webinar, please also contact the committee upon completing the survey. With that, let me turn it over to Dr. MacArthur for his closing remarks. Thank you so much.
Thanks, Marcella. And again, thanks for everybody for participating in this. Over the past 40 years, Southeast Asia has seen dynamic economic growth, with countries moving from predominantly agrarian economy to one much more industrialized. This growth has led people to migrate from rural farms into cities and industrialized zones to supply labor in the new technologic and service-based economies. These strengthening economies have provided additional revenues for those working in the new sectors, as well as new tax revenue for governments, and this has led to significant improvements in life and well-being. Epidemiologists speak of the epidemiologic transition where an economy moves from a less developed to a developed economy, and the population experiences decreases in child mortality, decreases in fertility rates, and increases in life expectancy. Children are less likely to die of infectious diseases, such as diarrhea, pneumonia, malaria, vaccine-preventable diseases. Birth intervals become lengthened and lead towards decreases in overall reproduction rates. That is, less children are born. The overall impact of this is an aging of society. This aging society, linked with increases in family wealth, contribute towards an increase in lifestyle diseases, which tend to be non-communicable. Diseases such as cardiovascular and cancer displace diarrhea and pneumonia as leading causes of death. With that said, the rapid changes in Southeast Asia have also contributed to increased human density, living closely with animal protein sources. This scenario has proven to be a fertile ground for the development of emerging infectious diseases. And over the past 20 years, Southeast Asia has seen the development of new diseases, likely originating in animals and passing on to humans, such as Nipah, SARS, avian influenza, and even COVID-19. These scenarios make Southeast Asia an extremely interesting and diverse health environment where you have ongoing emergence of new infectious diseases threatening the population, combined with significant morbidity and mortality caused by non-communicable diseases. As you students begin contemplating your future careers in the health field, the takeaway point from today's webinar is that the road is diverse with many options. The key is to find which option is the best fit for you. When I was young, I saw only two paths for a career in the healthcare industry, becoming a physician or a nurse. I chose physician. I entered medical school, and I was presented with the following career paths: internal medicine, pediatrics, surgery, obstetrics and gynecology, and the subspecialties that go along with these fields. I had no mentor telling me there's another way. In fact, when I selected family medicine as a specialty, especially that's not included in that prescribed list that was given to me by my university, a professor at my medical school asked me why I was throwing away my career. I found myself becoming increasingly interested in social determinants of health, such as family income, education level, gender, physical environment, access to healthcare, discrimination, among others. I found myself embracing the idea that preventing disease was preferable to ever developing the disease at all. And ultimately, I could have a larger impact if the community was my patient rather than the individual. I was moving away from the traditional biomedical model forwarded by many clinical professors at my medical school towards a public health and preventive medicine model. And today I serve as a senior management official developing public health policy for the US government's work with partners throughout Southeast Asia, improving the health of well over 600 million people. I share this personal experience with all of you because today we have heard from three distinguished panelists exposing all of you to the great variety of career paths that one can take in the healthcare industry. No longer are we confined to thinking of only pursuing careers as physicians or nurses or others in therapeutic services, but there are pathways in diagnostic services, support services, informatics, management, biotech, insurance, among others. Those pathways also travel down public sector roads, private sector roads, or even civil society roads. The road you choose is yours, but the journey will be exciting. To quote famous American poet named Robert Frost in his poem, The Road Not Taken, he said, "Two roads diverged in a wood, and I took the one less traveled by, and that has made all the difference." So as you contemplate your future careers in the healthcare industry, I urge you to consider all roads, for sometimes the one less traveled by can in fact make all the difference. I would like to close today by thanking our distinguished guests for the illuminating discussion today, and to thank the US-ASEAN Business Council and US-ASEAN Connect for co-organizing this event. Thank you so much.